vaccine to as many eligible people as possible, as quickly as possible in Canada. In addition, provinces and territories are showing innovation and flexibility in their efforts to roll out vaccines, including going into communities to reach identified priority groups and hotspots. This is welcome news. As of April 16th, there have been 3,738 reports of adverse events following vaccination. These include any medical event that occurs following vaccination but isn't necessarily related to the vaccine. 529 of these reports, about 1 in 18,000 doses administered, were considered serious, such as a severe allergic reaction. All serious events undergo a detailed investigation to determine whether the event is related to the vaccination. To date, there have been 3 reported cases in Canada of an adverse event related to blood clots with low platelets after receipt of the AstraZeneca COVID-19 vaccine. Last week, Health Canada provided an update on its ongoing safety review of these very rare events following vaccination with the AstraZeneca vaccine. The department concluded that they may be linked to use of this vaccine. It is understandable that reports such as this, as well as ongoing updates to information and recommendations related to vaccines, can raise concerns and questions and may prompt people to hesitate when they have an opportunity to be vaccinated. Since the onset of the pandemic, Health Canada, the Public Health Agency of Canada, and its partners have made decisions based on the most current available real-world evidence and data, updating guidance and approaches accordingly for the suite of authorized vaccines in Canada for use against COVID-19. And that will continue to be the case moving forward. Health Canada has authorized 4 vaccines to date for use in Canada based on its assessment that for each of them the benefits outweigh the risks. There have been 3 reported cases of a very rare event following the administration of over 1.1 million doses of the AstraZeneca vaccine. They are rare events, but they are serious. Health Canada will continue to examine and assess these and other safety concerns brought to its attention. In addition, Health Canada is looking at the evidence and working closely at the present time with international regulators in assessing the safety signals regarding the Janssen vaccine. Should a safety signal be confirmed, the department will take appropriate action, such as communicating new risks to the general public and healthcare providers or changing the recommended use of the product. The National Advisory Committee on Immunization, NACI, will also continue to review clinical data as well as all available evidence about how well the COVID-19 vaccines are working in the real world. In addition to the vaccine characteristics, NACI reviews mathematical modeling, assesses vaccine supply, and takes into account the programmatic realities of equity, feasibility, and acceptability. The committee's focus on public health perspective is aimed towards having the best outcomes for the greatest number of Canadians as quickly as possible in this pandemic context. NACI's guidance provides a framework to guide decision-making in the provinces and territories for their respective vaccination programs. Across the country, public health authorities in every province and territory are making decisions about and adjusting their vaccine programs, taking NACI's recommendations into account while also considering their jurisdiction's current epidemiology and context. Everyone should continue to follow the guidance of their local public health authorities. If you have questions, seek out a trusted source of information, like your healthcare provider, so you can make an informed decision about getting vaccinated when your turn comes. Once you receive the vaccine, remember to continue to adhere to the public health measures that prevent the spread of COVID-19, such as physical distancing, wearing a mask, and washing your hands frequently. Thank you. I will now invite Major General Danny Fortin to take the floor to deliver his remarks. Thank you very much, Dr. No.
To date, we have distributed almost 14 million doses of all authorized COVID-19 vaccines to provinces and territories. Earlier this week, we received 1 million doses of Pfizer-BioNTech, and the deliveries to provinces are now complete. We expect to receive 1 million doses of Pfizer-BioNTech next week to complete the shipments for the month of April. And for May, Pfizer-BioNTech has confirmed upcoming deliveries of over 2 million doses weekly. In June, we can expect to receive around 2.4 million doses per week, and this would bring the total expected of Pfizer-BioNTech doses to over 24 million for this quarter alone. Looking ahead, Pfizer-BioNTech has provided the expected deliveries until the end of June. This will provide provinces with additional flexibility and planning their vaccination campaign from these updated allocation tables. And this information has also been shared online, and I invite Canadians to look at Canada.ca COVID-19 vaccine websites for more information. As for Moderna, last week, manufacturer indicated it faces ongoing challenges with ramping up production to meet intense global demand. As a result, our next shipment will be smaller than expected. And as mentioned last Friday, we can now expect to receive 650,000 doses of Moderna next week instead of the previously announced 1.2 million. And those are expected to be distributed next week. I'm happy to provide an update on anticipated deliveries of Johnson & Johnson's vaccine. Canada will receive an initial shipment of approximately 300,000 doses during the week of April 26. And deliveries to provinces are expected to begin the following week at the beginning of May. In closing, while weekly fluctuations in shipments may happen, overall, the quantities of vaccines we can expect from manufacturers continue to grow, and so that more and more Canadians can be vaccinated. Bonjour à toutes et à tous.
Good afternoon, everyone. To date, we have distributed almost 14 million doses of all authorized COVID-19 vaccines to provinces and territories. Earlier this week, we received 1 million doses of Pfizer-BioNTech. Deliveries to provinces are now complete. We expect to receive 1 million doses of Pfizer-BioNTech next week to complete the shipments for the month of April. For May, Pfizer-BioNTech has confirmed upcoming deliveries of over 2 million doses weekly. In June, we can expect to receive around 2.4 million doses per week. This would bring the total expected of Pfizer-BioNTech doses to over 24 million for this quarter alone. Looking ahead, Pfizer-BioNTech has provided the expected deliveries until up to the end of June. This will provide the provinces with additional flexibility and planning their vaccination campaign from these updated allocation tables. The information has been shared online. I call on all Canadians to consult the website COVID-19 vaccine, Canada.ca COVID-19 vaccine website. As for Moderna, last week, the manufacturer indicated it faces ongoing challenges with ramping up production to meet intense global demand. As a result, our next shipment will be smaller than expected. As we can now expect to receive 650,000 doses of Moderna next week instead of the previously announced 1.2 million doses. For Johnson & Johnson, I'm happy to provide an update on anticipated deliveries of Johnson & Johnson's vaccine. Canada will receive an initial shipment of approximately 300,000 doses during the week of April 26. Deliveries to provinces are expected to begin the following week at the beginning of May. In closing, while weekly fluctuations in shipments may happen, overall, the quantities of vaccines we can expect from the manufacturers continues to grow so that more and more Canadians can be vaccinated. Thank you. I'll now give the floor to my colleague.
I want to acknowledge that I'm on the unceded territory of the Algonquin people. Indigenous communities and peoples are disproportionately impacted by the pandemic in the context of overcrowded living conditions, underlying medical conditions, and health disparities. During the second wave, the rate per capita of newly reported COVID cases in First Nations communities has been higher than that of Canada, but the gap has been narrowing since January. In the past 3 weeks, the reported case rate on reserve has fallen to below that of Canada. As of April the 20th, a total of 340,860 doses have been administered in 654 communities, with over 60% of adults in First Nations, Inuit, and territorial communities having received at least one dose. There has been many successful vaccination initiatives across the country, including a vaccine clinic in Calgary for Indigenous peoples that is led by Indigenous peoples, including the Aboriginal Friendship Centre, Calgary. There has been great uptake from urban Indigenous peoples in Calgary, where they administered over 400 doses in the phase 1 of the clinic and is expanding to administer close to 2,000 doses in phase 2. I would like to highlight Indigenous-led vaccine confidence campaigns, such as the Local Heroes Take Your Shot vaccine campaign in Akwesasne. Akwesasne has started to see the success of the campaign with an increase in vaccine uptake in the community. J'aimerais souligner les
I would like to underscore the vaccination campaigns launched by Indigenous people.
Akwesasne a commencé à
Akwesasne started recording successes from their campaign with approvals of vaccines in their community. During the initial phases, it is essential to continue following public health measures once vaccinated and to continue protecting those we love, our families and our communities.
immunization rollout. It is essential to continue to follow public health measures once vaccinated to continue to protect our loved ones, our families, and our communities. Miigwech, Nakumek, merci, thank you, merci.
Merci, Dr. Wang. We will now open the phone lines to questions. We ask that you limit yourself to one question and only one follow-up. We will be taking your questions in both official languages. Nous vous demandons de vous limiter à une question.
Please stick to one question and one follow-up question. You can ask your questions in any of the official languages.
On est prêt.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Mackenzie Gray de CTV News. Please go ahead, à vous la parole.
Hi there. My first question is for Major General Fortin. You had said previously that Canada was expecting 1 million doses from the Serum Institute this month. There's only 8 days left in the month, we don't have any further update on if we're going to get those. Can you confirm whether or not those doses are expected to show up this month or not?
Well, I'll ask my colleague from PSPC, Ms. Paquette, to discuss this in greater detail, but we will not see doses this month as the situation in India continues to be the way it is. But we continue discussions with the manufacturer with our colleagues at PSPC.
Yes, thank you for the question. That is correct. We are continuing to work with the Serum Institute on delivery of its vaccine to Canada. They are committed in supplying that vaccine, or the 1.5 million doses left to be delivered. And given the situation in India, there is a delay at the moment. Thank you.
My follow-up is for Major General Fortin as well. On the Moderna delays, it looks like the EU and Switzerland are not getting any Moderna cuts but Canada is. Can you explain why the company is not cutting shipments to the EU, but is cutting shipments to Canada?
Well, thank you. I can't comment on what other countries may or may not be receiving. What I can tell you is that we have assurances from Moderna that we have that they have applied reductions across the board. Canada, among others, is being impacted as they organize their workforce. I guess, for lack of a better term, they're increasing their capacity. They're scaling up, not without some of the challenges that they've experienced in the past, but they are quickly adapting to this. And we're in constant conversation with them. And I hope to have clarity on numbers, shipment size, and dates into May very, very soon. Thank you.
Thank you, Major General Fortin. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Geneviève Normand de CBC Radio-Canada. Please go ahead. À vous la parole.
Oui, en fait, je voudrais...
You know very well that the Indian variant is very disturbing. So, are you now recommending cancellation of international flights coming from India and other countries like Brazil as well?
Merci pour la question.
Dr. Nu here. Thank you for the question. It's a current problem now. We are having discussions and analyzing data and evidence concerning what is happening in India and other countries. We are looking into results of testing done at our borders. We will be making adjustments at our borders very soon. Question. The Indian variant, should we fear it to that point? Are those fears justified compared to the other variants we've seen elsewhere in the world, like the British variant? What is so special about this Indian variant? Answer. Thank you for the question. Dr. Nu, once again. It's technical. Certainly, variants are constantly mutating. It's only normal. It's part of the evolution of viruses. Through mutations, viruses can continue spreading and creating new strains. This is a technical matter. There are other variants of concern. What I understand now from what is happening with the emergence of the Indian variant, and it's the same elsewhere in the world, even in the United States and in other countries, and even here in Canada, we are constantly monitoring the emergence of variants. Now, we have variants of concern in India. It's something we are closely monitoring. As for flights, as you have noticed, we are looking into evidence and looking at the results of testing done. We are having discussions with our Minister of Health and other ministers and the Prime Minister as well. They are very involved looking into the matter, so we are expecting a decision on that very soon. Thank you, Dr. No. Next question.
From la prochaine question est de Mia Robson from the Canadian Press. Please go ahead. À vous la parole.
Hi, Dr. I'm wondering if you could sort of repeat what you just said in French about border measures coming soon in English, but also wondering, second doses, I've heard a lot of people being a little bit alarmed with the particularly Moderna and AstraZeneca shipments not being as reliable. They're worried about their second dose and what's going to happen with that. I'm wondering if you or Major General Fortin can reassure Canadians that the second doses are being properly managed.
Okay, it's Dr. Maybe I'll answer the first part in English. Well, as I was saying in French, is that with variants, it's part of the normal sort of evolution of viruses. They constantly have mutations, and only if let's say a mutation is sort of advantageous to the virus, that will continue to sort of be part of sort of maybe a new strain or a variant moving forward. So we're keeping an eye on it closely. Certainly, it's not something that we're just following here in Canada, but around the world. At a very technical level, it's interesting. There's a sort of a terminology aspect. We talk about variants of concern, but there's also sort of a level a bit below that from a laboratory perspective, where they're looking at variants of interest. As viruses mutate, as we look at to see what let's say the public health implications are, they're labeled at some point a variant of interest, and then at a certain point, if it looks like obviously there's implications for public health, be it being more transmissible, maybe causing more severe health outcomes and so on, then it becomes designated a variant of concern. So as best as I understand it, at the present time in India, there's variants of interest, and we're looking closely at that. I would say that, to be honest, variants are emerging not just in India, but around the world. I think, who knows, in the United States, even here in Canada, and that's something we need to keep an eye on. With respect to the border measures, what we're doing now is obviously taking a very careful look, looking at the data. We're always guided by the science and the data. We're looking at the results of the testing that we're doing at the borders, because all travelers coming to Canada are obligated to have a PCR test upon arrival. We're looking at that. We're looking at data we get from the provinces and territories. And I think, obviously our Minister of Health, other cabinet ministers, and our Prime Minister are very seized with it. They're having sort of active discussions looking at the data and so on. And I think that there might be a decision or something coming forward shortly.
Merci. Follow up?
Well, nobody answered my question about the second doses.
Oh, second doses. Certainly at the present time, I'll leave it to Major General Fortin and Ms. Paquette to talk about sort of shipments and so on. But certainly from my understanding in terms of the doses that are anticipated to arrive in Canada, certainly we're ramping up compared to the first quarter. And, with the recommendation, or at least the real world evidence that NACI has looked at and made a recommendation on, that the dose interval can be extended up to 4 months. It doesn't have to be. It can certainly be less if, let's say, we get more doses coming into the country more quickly. And I think Canadians can rest assured. I can even speak personally for myself. I received my first dose. My second dose is not, for several months, but certainly I'm feeling well protected, at least by my first dose, and certainly expecting that the immunity is lasting until I get the second dose, along with many other Canadians who have received their first dose. Thank you.
It's General Fortin. Perhaps just add the dose spacing of several up to 4 months gives a range of options to provinces and territories, and from a purely distribution number perspective, rather. I and the team are focused on providing as many doses as effectively as possible throughout the country for provinces and territories to immunize their people. And they will manage carefully, and we have constant conversation about managing the second dose and quantities. And there's questions about when can we expect to have visibility on AstraZeneca, for instance, and the Moderna, and we closely manage that. And at this point, I don't think that we should worry about availability of second doses. What we're focusing on is scaling up these, provide oversight to provinces so they can manage that as effectively as they can.
Thank you. And I'm also wondering if you might be able to talk, maybe Dr. New, about the equity of this vaccine program across the country. We've seen stories of people in some communities having to line up overnight to get appointments. I've heard others talk about trying to get appointments sort of akin to an episode or of the Hunger Games, and that people are getting access to vaccines who have the resources to work the phones or work the computer, and others are being left out. And it doesn't seem that this is a very equitable distribution at all.
Thank you. Thank you very much for the question. It's Dr. New. It's difficult for me to comment. Obviously, the vaccine rollout is being administered individually at the provincial and territorial level. I would say that certainly from my understanding is that the provinces and territories are doing their utmost in terms of distributing the vaccines as rapidly as possible to get as many Canadians vaccinated as quickly as possible. And to the issue of equity, I think certainly from a science-based perspective, we recognize that there's lots of factors in play, and as we've talked about, I think I've mentioned earlier, one of the key factors that we're looking about in terms of equity is that for most people, it's not just a question of the vaccine. We know we have to follow public health measures, in terms of, stay at home, all of the personal measures that people can take, but not everyone is in the same position. And there are many essential workers who also maybe come from, maybe not the same socioeconomic, let's say, class, to be quite honest, as others who have maybe the sort of the option of being able to work at home. And those people put themselves at risk. They're on the front lines, making sure that we have, food on our tables, and making sure that the electrical grid is still working, et cetera, et cetera. So for those people, I think the provinces and territories are taking steps to ensure that these people certainly have access to the vaccine. Same, I think, I understand that for other vulnerable populations where maybe there's conditions of more crowded housing situations, looking at hotspots and so on. Those are all elements that I think are being considered very seriously by the provincial and territorial authorities. So I can't speak to individual cases, but certainly I think the thinking, understanding, at least from a science-based and public health perspective, is there to make sure that there is equity. And the last point I'll make is that we recognize it's not strictly a sort of a scientific, technical issue, is that that is also a sort of a social determinant aspect to it in terms of social support. So again, getting back to the essential workers, many of them feel that they have to go to work because based on the fact they don't have paid sick days, that their salary or their wages aren't sort of guaranteed in the same way that maybe others have it better off. That I think that's something else that the governments need to look at to make sure that these people, if they let's say have the first sign of maybe a symptom and feeling unwell, that they don't feel that they're not in a position that they can't go forward to get tested, or they can't afford to take that day off work, etc., to make sure that they take the right steps to protect themselves, and also their loved ones and family. Thank you.
Merci. Prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Mélanie Marquis de La Presse.
Question, La Presse. Thank you. Good day. My question is for Dr. No. I would like to come back to the question asked by my colleague concerning the public health recommendation on the suspension of flights from India. You say the Prime Minister is looking into it. What is the recommendation being made by public health? Because we are right in the middle of the third wave. So what advice could be expected right away? Answer, thank you for the question. What I can say is that, and I'm speaking from a public health perspective, I answered a similar question yesterday. It's more about what we're doing at our borders. There are now many measures being taken to protect the safety and security of Canadians at the borders. All travelers coming to Canada must show a negative test result on arrival, and even after, they may have to show a second or third test result. And there's an obligatory 14-day quarantine. What I've also realized is that if we are talking about the public health perspective, it's almost impossible to stop the virus from spreading because borders are artificial. You will need to think of a natural barrier like an oceans or mountains. But here in Canada, we have flights coming in. We also have the land border. So it's not easy. But with the measures we have taken at the borders, like testing, we are able to monitor and detect the emergence of variants. But something else that is important is what we are also doing inside the country when we identify the variants. So for me, it's not only a matter of variants or, or original strains. It's very important for everyone individually and as a population to continue following public health advice, which have proven their effectiveness. So the virus is still here. We need to continue respecting guidelines. So once we know that there's a variant, yeah, we know it's spreading. It is important to educate everyone that it's not over yet. We need to continue implementing our public health measures. That's really the public health perspective. We need a global approach. We cannot only target specific countries because the variants are probably emerging in many countries, even in Canada. The issue is what we do later on with our public health measures. And at the same time, we need to continue with our vaccination efforts as well. Question. You've mentioned lots of things. You talked about mountains, natural barriers. I understand all that. Let's take the argument that the virus is circulating in spite of measures. That was an argument at the beginning of the pandemic. The borders were eventually closed. Now, concerning India, you are basically saying that we should not suspend flights because there's no outcome. Answer, no, that's not what I'm saying. We are looking into this situation. I cannot say exactly what decision will be made. It's not up to me to make that decision concerning flights from India. It's all about what we do at our borders. We should at least try to slow down the imports, not only of variants, but of all types of COVID-19 viruses. So we also know from evidence that the percentage of COVID-19 cases that are imported into the country is very low when we look at what is generally happening in the country with community transmission. So we need to be aware that, yes, what we're doing at the borders is important. We need to continue monitoring the situation and slowing down importation, but what is even more important is what we do within the country, in the provinces and territories with community transmission. Thank you, Dr. No. Next question.
Next question is from La prochaine question est de Ryan Tumulty from National Post. Please go ahead. À vous la parole.
Yeah, hi there. I wanted to ask about the AstraZeneca vaccine from the Serum Institute. I know you talked about this earlier, but is it fair to say at this point that we shouldn't expect to see any from India until their COVID situation is better controlled? And I'm also wondering with that, when do we expect to see more deliveries from either the COVAX stream for AstraZeneca or our U.S. doses?
Thank you for the question. On the Serum Institute, I can say that the company is committed to supplying their 1.5 million doses, and we're still tracking that for the end of June. Obviously, the situation in India and the exportation ban may affect that particular delivery. On COVAX, we are working with them On the next shipment, at the moment, we're waiting for that information to be able to provide to you, and it will be provided as soon as possible. And on the AstraZeneca of the 20 million doses bilateral agreement, we're looking at the next shipment in June and working with the company at the moment on solidifying that particular delivery schedule. And of course, on all three fronts, we are working with the company to ensure we get doses as soon as possible. Thank you.
Yeah, and then just as a follow-up, the Johnson & Johnson delivery, the 300,000 next week, I'm wondering if we have a line of sight, I guess, on when the next delivery will be of that, because I know we have a total of 10 million for that vaccine. I'm just wondering when we expect to see more than that first 300,000.
Thank you. The next shipment from Johnson & Johnson is expected in June, and we are working with them as well on determining the actual date of delivery. Thank you.
It's General Fortin here. Perhaps just to add a little bit of context here, I think it's important to celebrate that we have 4 million more Pfizer next month, and more as announced previously, as announced Friday, for a total of 6.4 in addition, an additional 6.4 this quarter alone. So a significant increase, and I know I've said this in the past, but this week, that's our slow week. Next week, with 1 million of Pfizer and 650,000 of Moderna, it's another step up, and we have steps into May onwards. So while we don't have huge numbers of Janssen at this time, we don't have a line of sight on AstraZeneca in the short term. We have yet to know the detail on Moderna for May, although they're working on scaling up. So the adjustment was quite severe last week, and they're working on scaling up. So I think we'll have very positive news in a short order with Moderna. The total amount of vaccine doses this quarter alone is well above 40 million, and this is end April, and we'll feel that significant increase in the next, starting week after next. So we will feel it, and we'll see a significant increase to the expansion within the provinces on the distribution network.
Merci. Prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Annie Guillemette de Cogeco Nouvelles 98.5 FM. Please go ahead. À vous la parole.
Question, Cogeco Nouvelles. Good afternoon. I would like to come back to Dr. No concerning what we could do inside the country when it comes to the variants and spread. We are talking a lot about closing international borders and suspending international flights, like flights from India, but the Premier of Quebec, Legault, is also talking about interprovincial measures. Is that something that is on the table for discussion? Answer. Thank you for the question. It's a current problem. It's really a matter for public health. Actually, public health wants to educate people to know that this is not time to travel, even in the province or between provinces. It's better to stay at home. I don't know how many times we need to repeat that message. It's the same principle. Stay at home. I go out just for the basics, buy groceries, but other than that, I stay home. So I think that it's up to the provinces and territories to manage the issue of traveling. We are hearing a lot about red zones, yellow zones. I'm not sure what's happening now. But if we're in a red zone, I think people should be warned and prevented from moving or traveling to a yellow zone, because that way we avoid the virus from spreading. Even before, there was an issue because many people realized that many Canadians took vacations to go ski or engage in other activities outside their province or even within their province. This is not the time for that. There's a crisis going on in many provinces. Look at what is currently going on now in Ontario with the intensive care units and young adults. I'm somewhat discouraged because I know that the staff members working tirelessly in the hospitals and nurses and doctors have been doing this for a long time, 13 months now. Now they see what's happening. They are exhausted. I feel for them. I've let go the work I used to do in the clinics, but I do feel for all the clinicians who are in the front lines. I think it's a responsibility for all Canadians. We need to know that this is not the time to travel anywhere, even within our own communities. I understand that we may want to take some fresh air. Yes, go to the park only with members of your household. But other than that, no. Let me repeat. I think the other issue has to do with essential workers. They don't have a choice. They are the ones who have to take the risk to expose themselves to the virus. So it's important for them to be supported and protected. Thank you. Thank you. Follow-up question. I would like to come back to the level of danger of the Indian variant. What do we know scientifically on how to protect ourselves with vaccines, the vaccines we are now getting in Canada? Because there's a lot of vague information regarding these Indian variant. Are we protected with the current vaccines? Answer. The science and experiments are constantly evolving throughout the world. Even manufacturers are continuing experiments in their labs when it comes to the effectiveness of vaccines against the variants that are evolving throughout the world. In general, the vaccines we have in Canada are very effective. It's important that everyone be vaccinated when they are offered a vaccine. It's something to monitor, but I cannot currently tell you what is happening when it comes to the effectiveness of a vaccine against a specific variant. It's something we need to keep monitoring, but what is important is for us to get vaccinated as quickly as possible, and we need to continue respecting public health guidelines. That is how we can protect ourselves against the variants and against COVID-19 in general. Thank you. Thank you. Next question, the last question.
The last question is from La dernière question est de Christy Kirkup de Globe and Mail. Please go ahead. À vous la parole.
Hi, good afternoon. My questions are for Dr. New. I'm wondering if we can just please circle back to the questions about international travel. And I'm wondering from a public health perspective, what is the rationale in this moment to allow for international travelers to continue to come into Canada when places like schools are shut down in places like Ontario?
Well, thank you for that question. I think that first of all, when we talk about international travel, I think I just would want to probably underline the point that we've made since the beginning that for Canadians here in the country, now is not the time to be traveling abroad. So I think that point needs to be stressed. with respect to quote travelers coming to Canada, there's certainly I think Canadians have the right to come back home. So there are a group of let's say individuals, Canadians who are abroad, and certainly they have the right to come home. There are also other groups that I think I'm not to get into details that do have sort of the right to sort of come back to Canada. For others, you're right. For foreign nationals and so on, yes, that's something that obviously is being looked at. I think in general, with what's going on in the country, need to take a careful look in terms of what we do with respect to, let's say, foreign nationals who might be coming to country for different reasons. For example, we talk about essential workers. So even looking at our land border, truck drivers that go back and forth across the land border, making sure that we in Canada have our essential goods, medicines, and food on our table. It's not that straightforward in terms of just looking at quote the nationality. But you're right; it's something that I think we're looking very carefully at, and if there's things that we could do to better, let's say, protect the security at our border with respect to the importation of COVID-19 in general, or let's say in this specific case, variants of interest or variants of concern. I'm sure that the government is taking that seriously, and as I said earlier, certainly based on the advice, the inputs that our Minister of Health and other ministers, including the Prime Minister, have received in the past few days, I anticipate that something will be sort of forthcoming shortly.
Follow-up?
This is the operator. I'm sorry. Her line has disconnected.
Parfait. On peut prendre la prochaine personne dans la ligne.
We can take the next person on the line.
The last question is from, la dernière question est de Tom Perry, CBC News. Please go ahead. À vous la parole.
Oh, hello. I didn't think I was going to get a question. Dr. New, can I ask you, you've talked about this a few times in French, but what evidence do you have, or is there evidence, to suggest that this variant we're seeing in India is any more virulent, any more resistant to vaccines than other variants we've seen?
I can't tell you personally. I think our laboratory and others are looking at that question closely. I think at this point, as I indicated earlier in French, it's the variants that have been identified in India are more variants of interest, which is not necessarily the same as a variant of concern, which I think in a general sense, we call it a variant of concern when it's certainly shown to be let's say, more transmissible or more virulent, causing a severe illness, hospitalization, and death. So it's something that's being looked at very carefully. But at this time, I would say it's something that we're still analyzing the data. What I can say is that notwithstanding what the impact is of vaccines or how the variants are reacting to the vaccines, I can say that through our testing regime at the border, but also the reports we're getting from the provinces and territories, we're looking at metrics like what proportion of cases and based in terms of travelers coming to Canada are coming from let's say specific hotspots. If you want to focus on India, everyone can see that right now it's unfortunately a tough situation in India. It's certainly I think a raging epidemic, or certainly the situation is not good in India. And obviously then we look at the cases that have been reported in Canada that are associated with travel from India. We are seeing metrics that there's an increasing proportion of cases that are linked to travel from India. And so those are the types of data that we're looking at in terms of seeing what adjustments we need to make in terms of border measures.
And for Major General Fortin, can I just ask you, on the AstraZeneca doses coming from India, are we going to be able to replace those in the short term? I know that we're supposed to still get those 1.5 million doses from the Serum Institute eventually, but in the short term, are we going to be able to replace those missing doses? I know the U.S. President was talking this week about possibly helping Canada. Is that an option? What are you looking at least in the short term?
I think I'd just pile on to what my colleague, Ms. Paquette, said earlier. We're still in close coordination with Serum Institute. We have discussions with all the different manufacturers, and it's too early to conclude that we have an issue with SI that will not be resolved in the coming weeks.
I was going to ask if the U.S. is still an option.
Thanks for the question. It was reported yesterday that there was a discussion between the Prime Minister and the U.S. President, and we are now working at the working level with the U.S. to determine next steps. Thank you.
That will be all for today's technical briefing. C'est ce qui met fin au briefage technique pour aujourd'hui. Merci beaucoup d'avoir été avec nous.
That's the end of today's meeting.